Oh, that building though, they're both haunted because you think about how many deaths have happened in an assisted living complex.
Yeah.
But there's one of the rooms on the far end. It is so haunted. Like we couldn't keep NOC staff over there because they're like, we heard someone, but no one's down there. That room's been vacant, and I'm like, well, so and so died, and the window wasn't open, and they were mad. So they're probably still here.
Yeah. Well, I was never even trained to open the window after somebody passed. Yeah. I was only 18 when I went in for my CNA and started working at a nursing home. Nobody told me that when they passed, you're supposed to open the window.
Yep, open the window, let the spirit out.
So unfortunately, I trapped them in there.
Don't put me. Do not put me in an assisted living for that one reason only. I'm not getting trapped there forever and ever. Lord have mercy. I'm Jamie. I'm not a support broker. I'm a regional manager for the Northeast region. I slipped back in time here. And I oversee right now, I have 4 support brokers and a couple of housing counselors, 1 housing counselor, hopefully another soon, and currently hiring.
Yeah. And I'm Cindy. I am the owner of Community Horizons, and I guess official title is Director of Operations. And just excited to see where this takes us.
She's filling in all the holes. She does a lot of things she's not supposed to be doing anymore, but can't get her out of the field.
It's my favorite.
Mm-hmm.
It's my favorite.
How did we get here?
What are we at, 8 years? Goodness. 8 years. Yep, 2017 started.
We started with burnout, and we ended up with Community Horizons 8 years later. So how did that start for you?
Yeah. So in Community Horizons, we call all of us healthcare burnouts. We all come from a very similar background of 24/7 on call. That phone is attached to you. It rings, you drop everything, and you run out the door. And I think I finally got to a point in life where I was kind of forced into it because my position, I was with a company and they eliminated my position out of nowhere. And I'm like, what the heck am I supposed to do? Like, what do I want to be when I grow up? And I just happened to have lunch with an old colleague at that point, and she's like, hey, have you heard of support broker services? I'm like, no, what is that? So she kind of lit the fire under me, and I'm like, all right, I have to look into this. This is interesting. However, I've never heard of this before. And I was an IRIS consultant. We didn't use support broker services at that point. So I ended up connecting with a gentleman down in Madison. He had a support broker agency, and he kind of gave me the ins and outs, what do we do? How do we support individuals? And it's all about, I think in order to really understand us, you have to understand self-direction. And that's what this podcast is all about. We're like the hidden gem.
You really are.
And we don't understand why. Because such an amazing
I don't know
program.
why we have to be a secret.
I know, right?
Because it's awesome.
So that's why we are starting this to get the awareness out there and show everybody how amazing this program is. So, but going back, I was at lunch and I started digging into this, and I'm like, all right, he's like, all right, I'm willing to give you a job if you want to come aboard. I'm like, no, I really want to try this on my own. So jumped ship and started doing it under the IRIS program. And I had to learn as I went, and just I had the human resources background that came with it, because a lot of support broker services is assisting individuals enrolled in self-directed programs with navigating the recruitment process and finding caregivers and onboarding process. So I had the background for it. I just didn't have the knowledge of what this is. So 8 years later, here we are today, and we have,
what are we at?
15?
15 and hiring for 3.
Yep. So definitely a growing organization, and really finding our fellow healthcare burnouts that come with it.
Yep.
So, and you were in the same boat.
Oh my word. Yeah. So I don't know if you remember or not, but I interviewed twice with you guys. Do you remember?
No.
I didn't think so, because when I interviewed the second time, I mentioned that, and you're like, really? I'm like, yeah, it was when we hired Abby. So I would have been applying for the same position as Abby in Green Bay, and that was a full-time position.
Yes.
And you guys called it, like I was not in a full-time place. My husband had just said, yep, go ahead and take time to figure life out. And going right back into full-time, I probably wouldn't have been as successful as the way that I started round number 2. But yeah, my like breaking point in like the healthcare burnout was I was on call like I always was, 24 hours a day. And I had a little tiny baby, and I was pregnant with my fourth, but my second little. And my daughter had taken her diaper off and crapped all over the floor while I was on call trying to staff a facility. And I'm like, I'm done. This sucks. I'm not doing this anymore. So I'm literally like cleaning up poop on the floor while I'm talking to someone on the phone professionally-ish and trying to like get a shift covered. I'm like, we're done here. Yep. This is it. And so I started like seeking out the best of both worlds. And I had no idea what a support broker was. And I'm not going to lie to you. I don't think I did for like the first 6 months. Like I really don't. I was willing to do the job and I was doing it well, I think. But like I also had no idea what a support broker was.
No, I think that's very common. Like I often reflect on our interview process and I'm like, are we really hitting all the bases when it comes to, because how do you explain support broker services in an hour interview? Right?
I don't know. And that's kind of like, I think our most successful hires that we've had are honestly the ones who come with like the passion, the drive for advocacy, and also like the empowerment of the population, because you really can't explain it. But I think if you have the determination for advocacy and seeing people succeed, however that looks for them, I think those are the ones that stick it out and that work out because they already came to the table with what we can't really explain.
Yes, I agree, because we talk a lot about like, what is our why? What is your why? If you don't have the why, you're not going to be successful. And the why always has to boil down to your members.
Oh, absolutely.
Right? If your members are not the why and they're not the ones that drive you to want to be out and about and with them and navigating the system, you're not going to work. You're not going to be successful.
Absolutely not. Yeah, you have to want to see people succeed, and you have to be able to humble your own effort. You have to humble yourself. Yeah. Because what I think is good is not what they think is good. Yeah. And honestly, I've never lived in a full-time wheelchair. I don't know what it's like to live with a developmental disability alone in an apartment. So like, who am I to come into someone's home and say, you must, or do this, or I would do it this way? What do I know? Yeah. So like being able to meet people where they are at and say, I'm going to support you like that. Yes. That is self-direction.
And how they do life.
Yeah. They're like, and what's important to them? What's important to me is not important to them.
Our opinions don't matter, right? And that's the thing that we have to train every single time is you hear, oh, I think this and I feel, I'm like, it doesn't matter. I'm sorry.
No, the I feels come behind the scenes when we all rant to each other about the heartbreaks of the position, because there are heartbreaks. Yeah. But that's behind the scenes, because in front of the member, it is whatever they want. You don't want to live there? Awesome. I get it. You don't want that choice. Staff member, even though they're qualified? Cool. You must have your reasons. Yeah. And just leave it at that, because they get to have the choice. Yep. And we live in a society where they don't have a lot of choice. Yep. People with disabilities are told what to do 99% of their day, where they can work, what they can do, how they can dress, how much money they get, how much money they can earn. Yep. We can at least give them the choice of the care that they provide in their own homes on their own time.
Yep. And that's what self-direction is. Right. So we wanted to start this podcast, and it's get fired up, right? There's a lot of topics to get fired up about self-direction because of lack of choice being one of them, lack of just education and knowledge that this world is even out there. So when is the first time you heard about self-direction? When did you?
The very first time that I'd ever heard of self-direction is through this company, through Community Horizons. In all of my years working in facility and working with case managers that I still am working with now, I had never heard the word self-direction ever. Not at a conference, not in any of my education. I'd been in contact with DHS because I have disabled kids. Never in that dialogue did I ever hear that was going to be a potential option going forward. So it's not in anyone's vocabulary. Yeah.
And how is that, like, you come from a personal level as well as the professional level. And the fact that you weren't even given that option
No.
is mind-blowing to me.
And even so now my son just transitioned to adult care, and the team that was assigned to us initially wasn't able to assist me with self-direction because they didn't understand self-direction.
Yeah.
I knew self-direction. I knew what I wanted, and we were not communicating because she didn't know what I was asking for because she didn't understand self-direction.
Yeah.
She was very insistent that I was going to be a natural support, and I'm like, no, I want to self-direct, and I want to be a paid caregiver. And actually, the reason why I went paid caregiver for him is because her way she educated me was that if I was going to provide those cares for him, then I had to be paid. I'm like, I can't do it natural so that someone else can take my place. It was very confusing. It was very, 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 it got convoluted so fast. But yeah, so like they aren't really educating because they don't get it.
Right. Well, and that's the hard part. They're the referral source, right? It starts with them to understand. And I mean, this can be a whole topic in itself, but we're gonna try to get guests on here to help us understand the background of it, because we know what's in front of us. We know what happens when we get that referral and what our services are. But oftentimes we hear is, how have we never heard of you before? And that's a good question. Yep. Like how is self-direction not more of a thing, right? I'd be very curious to know, like, what are the statistics as to how many people are enrolled in IRIS or family care? How many people are enrolled in like a self-directed program? And how do they know about it? How do they learn about it?
Or do they even know they're self-directing?
Yeah.
Because that is what I've run in professionally a lot, is that they actually don't know that they are self-direction because they are not educated. So they don't know. I mean, goodness, we've been working with people for an embarrassing amount of time, and they don't know that they're the employer. Yeah. That is the crux of self-direction.
Yeah, it is. How
did you not know you weren't the employer? So they're not educated from the very foundation upward. And again, it goes back to just a lack of education. And I say that with like just a bunch of love and compassion in my heart, knowing that most people working within the industry are trying to do the right thing. Mm-hmm. There's only so much time in the day. There's only so much education provided to them. Mm-hmm. So you cannot give what you do not have.
Right.
So I don't mean to cut anyone down. It's more or less, there's just an overall lack of education. And I think the state of Wisconsin is really going to push self-direction. Mm-hmm. And I think that people need to understand it in its full capacity.
Yeah.
On what it can offer you and how independent it makes you and empowering it is. And like the big difference between agency and self-direction.
Yeah.
Like, what are your pros? What are your cons? What are your risks? What are your benefits? Because there are risks and benefits of self-direction.
Always.
It's not going to be for everyone. I personally believe with our support, it is for everybody, but the risk and benefit does have to align with the member.
And you're free of choice, but you're not free of consequences.
Correct.
Right.
That's hard.
And that's the hard part. I think, especially for us sitting back, you're like, we don't have to agree with the choice, and we know the consequence that's going to happen, but it's their choice if they decide to fire their caregiver and go without or hire somebody who we might not agree with, but it's not our choice. So we're not the ones that have to work with them day in and day out. Right.
They have to be the ones comfortable with them coming into their home.
Yeah.
That is their choice.
Yeah. So I guess we should maybe start with like, what is self-direction? For somebody watching this that don't know, like, self-direction is a wide term. I realize that just doing a simple Google search, like looking for self-direction books even, it's self-determination.
You're going to get a lot of different things.
Yes. So for anyone coming in and listening, like, what is self-direction? What does that mean?
How I would describe that if I was educating one of our members is self-direction is determining the kind of care that you receive, when you receive that care, who's providing that care, and the empowerment to call all the shots. Mm-hmm. I also make sure that I do explain that you are the employer of record. So you also get to make your schedule. You get to approve time cards. You get to run your home however you want to run your home, and your caregivers however you want to run your caregivers. I mean, it's so much broader than that, but I think in the scope that we most often find ourselves, we find ourselves in that recruitment category. So that is how I would describe self-direction on a very limited scope.
Yeah. So anyone, it's a Medicaid funded program. So anyone in Wisconsin that, or I guess nationwide for that matter, they can utilize their Medicaid budget to hire their own supports. So that can either go, they can hire agencies, they can go the self-direction route and hire their own, family members, neighbors, friends, just anyone that comes in. So their connections become, I guess, more personal, right? Self-direction is more personal.
So much more personal.
You have the say in who comes into your home and who cares for you.
Yep. And agency side, you get who they send.
Mm-hmm.
It doesn't matter if you like them. They're showering you that day.
You get who you get.
Yep. And you don't throw a fit.
It doesn't matter.
Yep.
Yeah.
On the self-direction side, you get to choose who's showing up at your house
to
do your very intimate cares.
Mm-hmm.
Who's going to know a lot of intimate details about your life.
Yeah.
Bank account information, like anything you share with them, where you keep your knives, like they're going to know all of it.
Right. Yeah. I told my kids and my daughter specifically, I'm like, don't you dare. When I get to that point, you're my caregiver. Like, after everything that we have accomplished, please do not put me in a residential facility. Like, you are now the caregiver, and you're going to have to put me in self-direction.
Yep. The very, very last facility that I managed, I came home after orientation day 1, and I looked at my 2 oldest girls, and I said, don't you ever put me in facility. Ever. I will haunt you. I will haunt you.
I think we've seen so much.
I've seen just way too much.
There's facilities, there's a time and a place. And, if it's appropriate, absolutely. I understand it. But with this program out here that is so empowering, because it doesn't matter. People of all different walks of life, they get to use their voice and have their own choices over their own life.
Yep.
And as you mentioned earlier, like individuals that are often not given a lot of choices of, your day is scheduled for you.
Very much so. I mean, even down to, we work with a lot of members who have to wait for someone to toilet them. So your toileting schedule is scheduled.
Yeah.
Sometimes by a third party.
Yep.
How unfair. How unfair. So to have the choice to say, I don't want to be toileted at 3:00. I would really like to be toileted at 1.
Yeah. Well, and to have one of my biggest pet peeves going into a facility, when I was there, I would walk in and it'd be like, or I guess going even back to getting into healthcare. When I was trained, it was, you have to have so many people up by 6 a.m. I'm like,
in jeans.
And at 18, and even then I'm like, do they want to get up? Like, if you're waking me up, I'm throwing punches.
Yeah, I'm not gonna be nice to you.
Don't.
No.
But that's how we were trained. Mm-hmm. And then going in and being like, all right, so many people have to be in bed by time night shift. Why? Do they want to go to bed?
They're not babies. They don't need to go to bed at 8 if they don't want to be.
So it's, even if they're not even trying to like break resident rights or anything like that. It's just something that I feel like is trained in healthcare.
And it goes generation to generation of caregiver. Like it's just trained in, and it becomes a culture of the facility.
Mm-hmm.
That it's just normal that knock shift has to get X amount of people up on knock so that day shifts can run smoothly, because historically we're just going to always be understaffed in healthcare. So they're understaffed. They're running 1 caregiver per wing, and that's a lot of bodies to get out of bed.
Flashbacks. It's like, hey, you're gonna do this wing and this wing today. I'm like,
and then you're gonna pass meds by 9.
Yeah, all of them. And then by the time you're done passing meds for that one, you have to turn around and do the next round of meds.
Mm-hmm.
Yeah.
Mm-hmm.
Yeah. And I'm like, man, you better go down the same path that you just did, otherwise they're getting back-to-back meds.
Yep. I say it all the time. You couldn't pay me all the money in the world to return to facility care at all. My gosh, it's heartbreaking. And that's why I'm so passionate about what we're doing.
Mm-hmm.
Like you said, there is a time and a place. I get that. When you have someone that's wandering, getting in their own vehicle and driving, and they have Alzheimer's, like there's a time and a place for a facility. But I would say everybody that we work with is very appropriate for home care. And I really think most people are, unless they have a significant risk factor like that. Like they are falling a lot, or they're getting in a vehicle or wandering.
Mm-hmm.
Something else I wanted to touch on, since we're talking education, educating the disabled population of self-direction, but also educating the population of caregivers.
Yes.
That we need to be able to support people at home. Caregivers, I've never talked to a caregiver that knew what self-direction was. I've always provided that initial amount of education. And I really want it to be understood that it can be a full-time job. A lot of our jobs are part-time, but that doesn't mean you can't stack. That doesn't mean that you can't work independently for several different, members in the community and really build a fulfilling position that's not going to burn you out.
Yeah. I think, when we're talking to applicants, we had one that asked us straight out, is this a scam?
Oh, yeah, because it totally seems like a scam. Too good to be true.
We're going to send you just to a random address. Hey, we're not legally the employers, right? We're working with an individual who wants to hire their own caregivers, and this is the task, and this is the hours, and this is the pay. Are you in? And they're like, yeah, absolutely. And then we're like, all right, we're going to meet you at this address. And they're like, are you sure? Are you sure? But hey, props to the ones that actually show up.
I know.
Because it's not a scam. It's an amazing program, but I see how they could see it that way.
Absolutely. And it's just very intimidating. I mean, every single home that we walk into is different. They have dogs, some smoke, some don't.
Yep.
Some have a live-in roommate, some have significant others, some have kids. You don't ever really know until we get there. So it's very intimidating to walk into someone's personal space and be like, hi, I would like to work for you. And again, going back to the scam, they really do seem scammy because when we're doing the education on our phone screens, we're a third party.
Yeah.
The person paying you is a third party. And what the heck is a fiscal agent?
Right.
What's a fiscal agent? That's a dumb word. And so that, and then you have the member who has a disability, and sometimes it's a significant disability, and we're telling them that they're going to be your boss. And so they're all like, what, and what?
It's confusing. It's very confusing because then they come back to us. We're their first point of contact. So, of course, they're going to keep coming back to us and being like, all right, how do I get paid? Where do I submit my time? I had one, she called me and she's like, she's sending me to Burger King to pick up a meal. I said, yeah, that's her choice. And she's like, but she's diabetic. Okay. Again, that's her choice, that she is the employer. She is able to, direct you any way that she feels fit for her. And she was there for more of the supportive home care side of it. But she was so reluctant. She's like, I don't know. Should I be feeding her this? I'm like, you're not feeding her anything.
You're just the wheels. Go pick it up.
Yeah.
It's your literal job.
So it's just random things like that because they're so used to the other world, the residential world, or the home care agency. I mean, I remember as going back to home care, one of my members sent me out for cigarettes. And I called my supervisor. I'm like, am I supposed to be doing this? I wasn't. It was against the agency rules. But on the self-direction side, I mean, they're the employer. So it's really hard to
say no. When I do the education on phone screens, I kind of always say something to the effect of this is like the Wild West of healthcare, because it kind of is. There's not, it's grossly underregulated for being a government program. And you can literally hire someone off the street to straight cap you.
Right. There's not, so on the care side, and we'll hopefully have some care managers in here as well to help clear up any misconceptions. So, but I mean, they authorize the services. So they authorize what comes in, what you're allowed to do under that service code. So there are some that, we do kind of report back as to, hey, is this a thing? But it speaks to more than just caregivers, because you don't have to be a CNA. You don't have to be an LPN. You don't have to be an RN. It can be anybody who just enjoys the company of somebody else and caring for somebody else. Yep. We have so many positions that we're assisting members with filling on supportive home care tasks. It's just house cleaning or companionship or kiddos, going and doing respite or childcare.
Yep. The fun stuff.
It's such a wide pool versus such a narrow scope of we just are looking for caregivers. but that's not the fact.
I mean, really, we're looking for newly retired individuals. We're looking for stay-at-home moms looking to sneak out of the house for a 2-3 hour shift a couple times a week. We're looking for a high school senior, college kids looking for summer work. Like, those are the people, not just the CNAs, RNs, people who have PCW experience. Those are the people that are going to fill in these gaps like so beautifully.
Yeah.
But they don't know that we exist. We don't know this world exists. So like, how do you explain it in like a broad way, not a broad way, but like a big way to get it out to the masses versus just one phone screen at a time.
Yep.
Other than doing something like this and putting it out there so that people will hopefully understand that you can build a decent job, like a decent career doing this. And not to take everyone away from facility and from agency, opportunities, but this might work better for a lot of people who cannot be dictated to a 30-hour work week a week. Or someone who is just flat burnt out but cannot leave the industry. Because I can't even tell you how many times I tried to leave healthcare.
It just pulls you back in. It just sucks you in.
It does. Like, it
sucks the life out of you sometimes.
and then sucks you back in. Like, you have nothing left to give. But
but we miss it. You miss it. You leave and you miss it. And you're like, this is not for me. And then you get back in. And I think it comes back down to the member. It does. Right? It comes back down to the individual that you are serving, because it's a feel-good job.
It really is. Because it's, what is it? Like, our average, I would say our average is probably like 12 to 15 hours. Like, one person, like 12, 15. That 12 to 15 hours keeps someone at home safely.
Yes. And
that's life-changing.
That is huge. It is life-changing, because without it, I mean, what do you got? Yeah. What's the alternative? Yeah. They go
to facility care, or they simply go without, which is just so dangerous for so many of our members.
Yeah. We're really hoping to have this get out there and educate people on what it is and how amazing it can be, and the life that you can build, not only for yourself, but for the individuals that you're serving, and to get fired up about the topics as well.
Yeah. At the end of the day, people are probably like, why are we getting fired up? Then they heard that you said it's a Medicaid funded program. They're like, oh,
it's good.
Noted. All right.
There's a lot of topics to get fired up about right now.
There's so many changes from the kid side all the way to the adult long-term care side. Yes. And none of it's going to be friendly or kind to us. I mean, there's a lot of stuff that's going to come down the pike that's going to be unfriendly. And we're going to ride the waves and figure it out with people, but it's, and we are, I never really understood where the grant came from that got our wages higher for MCOs, for the family care. But I did hear through the grapevines that it wasn't a forever grant. So I'm very nervous that funding is going to leave, and where you're going to fall back down to like that $8 to $11 an hour. That's not going to happen.
No. Well, you're competing with every other industry out there. Like, healthcare is not the only industry that is what they call the lack of staffing, or
everywhere.
It's a crisis. It's a staffing crisis. It's about getting people involved. It's about keeping people involved in the industry. So if you're competing with a fast food restaurant paying $15, $16 an hour, what do you do? Like, you have to pull that passion at that point. Is it your passion to go work in fast food, or is it your passion to help somebody and really give them a purpose? Because not only are you helping them, but you're keeping them at home as well, and putting yourself in their shoes. Like, if you were in their shoes, where would you want to be? What would you want to do? What choices do you want to make?
So it comes down to like, purpose and passion. I mean, really, do caregivers stay for any other reason? I mean, if you don't have at least a little bit of that, the world would just chew you up and spit you out. Yeah. It's heartbreaking.
Do you remember walking in, like, when you were training or hiring somebody, do you ever make wages and like how long that person was going to stay?
Yeah. Are they going to make it through the background check?
Are they going to make it through orientation?
Hard no.
All of a sudden, halfway through, they have to go to the bathroom, and you're like... I remember we used to have a group at the nursing home. And we were probably not the nicest coworkers, to be honest with you. They'd walk in and you're like, yep, that's not going to happen. That's not going to.
Yep. It was always like the really nice and sweet ones that would make it through, and then staff would just chew them up, and then they would leave. But I mean, it was pretty obvious like who was not going to. I had one gal, I worked at one facility, and she was a med tech, and she put her keys on the counter and walked off the job. I wasn't there. It was on a knock shift. So I had to scramble and figure that out. Well, she came and applied at a different facility a couple of years later that I was managing. She walked in the door and she goes, nope.
I'm done.
She turned around and went back to her car. And I looked at my coworker who also had worked at the last facility with me. I'm like, did you know who that was? I do.
You made a lasting impression on that
Sure
one.
did. I think I reported her. I would have to imagine I did. That was abandonment. Yeah. So yeah, that was funny. It's just nope. Turned around with her whole face.
Yeah. Oh goodness.
Yeah.
I think you have to have the purpose and the passion behind it. Otherwise, if it's just a paycheck, it's not going to work.
No, even in what we do, if this is just a paycheck to you, it's honestly, it's not going to fill your cup. Like it's go work at Walmart.
Yeah.
Like this is not, if it doesn't do something for you and your soul, it's not really going to be for you.
No,
it's not for you. It's, at the end of the day, it's human services, and you have to like humans at least a little bit.
Right. You have to tolerate them.
Yeah, you have to at least tolerate them. And believe in the mission. I think that's a struggle we've had with our personal recruitment for our open positions is we do really love the burnouts. That's who we want and want to attract. However, if you spent a lot of time in a facility and you believe that everyone belongs in a facility, those are not people that are going to work out because not everyone needs to be in a facility. And let's face some huge facts. They're not getting any better care in facility than they are at home.
No.
They're consolidated. You can care for 46 people in one building, but they're not getting better care. No.
Well, and the great thing is if anyone is kind of over the whole facility scene and coworker scene, a lot of times you're just working with the members one-on-one, right? You don't have to deal with your coworkers, the mean coworkers that run you out.
That's true.
Like you.
Yeah. Nope.
We've been there. We've all been there before.
I have mostly only the staff that I built at facilities, they tended to follow me when I left. Yeah. And that was awesome because that means I'm awesome, but at the same time, I would dismantle buildings because they would follow me to wherever I ended up next.
I could see that.
Yeah. Because I have a very unique management style and personality, and I really work well with the underdogs, and a lot of caregivers are the underdog. Yeah. And I kind of take them under my wing and want them to do better as people, but also show up for work. And because they're doing better at home, they're going to show up for work. And so I tended to make a lot of friends that traveled the earth with me through facility.
I can see that. Yep. I was once told I was leaving a position, my very first nursing home position, to go be a manager for a group home. And one of the nurses told me I would never make it. I would never succeed. What? And I'm like, Look at us now.
I know.
I'm like, that was rude.
I know.
I went back to visit just to show her that I was succeeding.
I own a business now.
I'm there. Well, so to give her credit, I was extremely shy. I did not talk to you unless you talked to me.
That just shocks me.
I know. Growing up, all through, I was so shy all through school. I was the quietest person until I got into healthcare. I feel like that's when I started opening up. And especially when I got into management you
have to have a thick skin.
You have to.
You have to have a thick skin because it is advocacy. So you have to be willing to fight for people.
Yeah.
You just do.
Yep. I remember telling them this is not how we're going to do things here. Going in and just trying to establish hey, I got to establish my role, right? My first management role, and probably didn't do it the right way, but we had a great team. No, we're here for the members. This is their home, and this is how we're going to treat them as if it's their home. Same in any other position. I go into assisted living facilities and no, it's happy hour. Let them. Do they have a doctor's order saying they can't drink?
But even if they do, they can still leave the premises and go have a shot. They're adults.
But so we're not going to allow them to do that. But we're going to allow them to go across the street to smoke because it's a no smoking. So what's going to happen if
they're going to wheel themselves with that one arm that is not affected by the stroke across the busy road to have their cigarette?
Can't have a shot, but
because you're not allowed to push them because that's enabling them.
Yeah. Resident rights again. Let's lock up their cigarettes and their lighter, and they have to ask permission. Yeah.
Yep. A natural consequence. Oh, when I was at the AFH, we had a we had a gentleman, he called me Miss Lady. I loved him. And he smoked a lot, and his guardian would only give him X amount of money for cigarettes a month. And really that's all that the law required, and it's fine. He would spend his entire allowance on his cigarettes. And his guardian was like, if he smokes them all in one day, well, then that's a natural consequence. I'm like, no, dude, that's a consequence for us.
Yeah.
We have a 26-year-old, 6'3" individual who's withdrawing for 3 weeks. No, thank you.
No.
Absolutely not. In a high acuity mental health, no.
You don't want to deal with that.
No way. No, I mean, just how ballsy I used to be. I still am, but like back then, I mean, I worked in a 6-bed at high acuity mental health, and I was fearless.
Yeah.
I was so fearless.
Remember the reaction we got from support brokers when we would take them to home visits and just walk into, like, you and I don't even think about it.
Well, I think a little more than you.
I just walk in any door like, oh, my member lives here, I have to go in. We lost somebody because they're like, no. Remember, she quit. One of our housing counselors, because she's like, this is a bad neighborhood, that's a bad neighborhood, that's a bad. I'm like, that's great, because we go to that one, and this one.
Those are all low income housing. We travel there daily.
And they're like, she's like, by yourself? I'm like, yeah.
Mm-hmm.
Like I walk in and I'm like, lead the way. Where are we going? I don't even think twice about it.
No, for the most part, I don't either. I think the only one that was like, I've ever told you I can't go back was the oxygen smoking.
Yeah.
That was like it was a hoarded oxygen smoking situation. And that one I was like, nope, can't go back there. But you didn't bat an eye. You sat on that ottoman to get a signature as she lit up with her oxygen on. I'm like,
she's like right here. And I'm like, all right, sign here and sign here.
And I'm sending my location to people because for sure we're dying here.
But that's the best part about it is I'm like, until they have mentioned it, and I still don't even blink an eye. Honestly, I will walk into any home, whatever. If it's a little sketchy, I might send you a message and say, hey, this is where I'm at, or drop you a pin or something like that. Fun fact, I don't even know how to drop a pin. So I'll send you a text message. Yep. But I mean, and then we had one of our members, I was telling them about an area. They're like, yeah, you don't go there without protection. And I'm like, oh, like pepper spray? And they're like, no, like a bullet. I'm like, well, oh, okay.
Yep.
But I mean, if you're not even from the area.
Yeah. And we're talking Green Bay people. Like we're talking Green Bay. So like that's literally 30 minutes away.
Yeah.
But yeah, I think probably the same member, he would refuse to meet with me after dark.
Yes. Because
he didn't want me to come back in when it was dark out. He said that this neighborhood changes after dark. And I'm like, what do you mean? It looks nice here. I live here.
And I pulled up and we were in a neighborhood and Abby and I were going into a home visit or a referral meeting. And I'm like, oh, this is such a nice neighborhood. She's like, lock your doors. I'm like, seriously? She's like, yeah, lock your doors. And I'm like, it looks nice. I guess looks are deceiving.
They are.
But that's the best part, I think, in the self-direction. Again, they come from all different walks of life. It doesn't matter because they still need help. Just because they live in maybe not such a great neighborhood, they still need help.
Yeah. Or like the conditions that they live in. I think we walk into a lot of situations that people aren't living how we would choose to live. But as I've worked in this industry and on this side of self-direction, what I've learned is they don't want to live like that either. No. They're lacking help.
Yep.
They lack the care resources to have their dishes done. They lack the care resources. They have their laundry kept up on. Like all the things that like we walk in and we're like, oh man, like they're just trying to get by. They're, that 12 hours a week that we speak of is the difference between having a home that you can like safely live in and one that is not safe. And a lot of our members do live on low income housing, whether that be Section 8 and Section 42. So they have housing inspections. So they are at risk of losing their housing because they don't have the care to get their basic needs met, to take out their garbage, to do their laundry, to do like get their garbage out, because that's a huge issue. Yeah, because the housing authorities are not nice about that because it can cause so much damage when you have like gross food and stuff like that hanging out. Yeah. So even like the hoarding, sometimes it's not true hoarding. Like if you don't have the physical ability to get boxes out, they sit. If you don't have the physical ability to organize something, it sits. Yeah. So like it all just kind of just blends together. Like that 12 hours of peace of hours just makes everything in that person's world accessible.
My probably roughest referral meeting that I went to. I went in it alone, which we normally don't do. We usually go in twos for a variety of reasons, but I went at this one alone, and I walk in and he was just mad at the world, cussing every other F word, right? Just cussing me up and down. And I'm like, hey, I'm here to help. Like, what is going to make you happy? Just take that garbage out of my apartment. Okay, done. Like, I'm going past the dumpster on them. And then it just is amazing how things changed from there.
Mm-hmm.
And it's like, he's gone without care for so long that all he wanted was somebody to take out his garbage.
Yep.
Like,
And it's such a small little task that we all take for granted.
Yeah.
One of our old members would say, "You able-bodied bitch."
Oh, I love it.
And that is how he referred to me for the entirety of our relationship.
Hey, that's okay. It works.
But we do. I mean,
we're referred to a lot of different things, but
we, we take for granted the fact that we can walk, the fact that both of our hands work, the fact that we can drive a car,
the
fact that we have access to all of our money. Like that goes back to that. They don't have a lot of choice. They are not always given 100% of choices in life.
Nope.
So we don't, even though we are like fierce advocates and we're working in this work, do we truly know what it's like to be disabled? No. I mean, I can advocate really hard because I see it day in and day out. I can see the holes in resources, the cares in staff, the care and the gaps in understanding. But I don't know what it's like to live as a full-time disabled person.
No, I think if this job teaches us anything, it's taught us that you don't take things for granted because life can change in a blink of an eye.
Oh, absolutely.
How many
members we have that literally car accidents or, freak accidents.
Yep.
They went from walking the streets one day to completely disabled the next. Yep. I think that, I won't lie, that is something that gives me like an immense amount of anxiety. I work through that on like a very regular basis. Like MS, ALS, like those diseases that are so crippling without cause, without like any warning, they can just take you down. That gives me so much anxiety because I see our members live with it and the struggles that they have and the way that they are forced to do life. And it's so humbling to have disease progression so far in your face and just know that life can be taken away from you in the blink of an eye. We have many members with kids, small families, husbands. We're working full-time professional gigs, like typical people. And, one catastrophic disease later, they're wheelchair dependent, waiting for their caregivers to come empty their cat bags. Like that is, I work through that anxiety a lot because it's just so stinking humbling.
It is. But that's what I love about that self-direction program is no matter what that disability looks like, right? Where they're at in life, it's a program for everyone. Anyone can go within. I guess I shouldn't say anyone, right? Except for that. So I think that has to be one of our first fired up topics is these changes within IRIS right now. We don't have to agree with them. It's not our choice. But there's so many, the new waiver program came out. And we're going to have to dig into this like episode after episode until we truly understand this.
Yeah, because we're just starting to get the information, so we don't have a good understanding. But what we do know is devastating to the IRIS community. Self-directed IRIS community.
So IRIS is fully self-directed, right? If you're going in IRIS, it means that you are fully self-directing your cares, your program, everything that has to do with in your role of every day.
To like further explain that, so that's down to, the consultant gives you the resource, you make the phone call to get it set up. They give you the resource, you make the phone call that goes to your chucks, your briefs, your taxis, all of your care service, whether it be counseling, medical appointments, all of it. So that's fully self-directed.
Right. Because the IRIS consultant, which some would say like a care manager, but they're a true consultant. Here are the list of resources. This is where, you can call these numbers and work through what you need.
Down to negotiating rate, from what I understand. On that last meeting that we had with them, they can negotiate rates with these providers. Because that is part of the self-directed model.
So with the support broker, a lot of IRIS participants are utilizing a support broker to assist them with navigating these systems, right? The last waiver, I would say support broker was more broad, but it was narrowed.
Mm-hmm.
Even before that, so let's go way back for when we first started, right? It was support brokers were really there to navigate any process to help keep you in self-direction, to navigate any self-directed process. Okay, so now we got into around 2020-ish. Support brokers, we were no longer assisting with like the Medicaid renewals and the food share. That went back to the IRIS consultants, and we were assisting with navigating, like helping them find applicants, helping them find care providers, helping them call agencies, helping them set up transportation. Now we're in 2026, and this new waiver and this new scope is saying support broker services are back to assisting with Medicaid renewals and food share.
With the language only.
Only. So they kind of cut out. Now they're expecting IRIS participants to, they're pretty much saying, you're in self-direction. You have to be able to do this, right? Yep. You have to go find your own caregivers. You have to interview. You have to do the new hire paperwork, which is, let's be honest, that new hire paperwork is crazy.
It's insane. It doesn't matter what fiscal you're with on the IRIS side. It's just hard.
It is.
It's just hard.
Yeah. I mean, we do this professionally, and we get packets sent back because you forgot to dot your I.
Yep. Or the date, or the date wasn't in a 224 format.
Yes.
It was the right date, wrong format. And then you get kicked back because it goes through the AI generated first, and then back it sits on someone's desk. So yeah, it's a lot of steps for individuals, and like to outline like the kind of participants are out there in the IRIS world. It's anyone from a very, vanilla disorder all the way down to someone who has, who's completely blind and elderly, and is self-directing and has self-directed for how many years, that individual?
So she's been with us for 7, almost 8 years. I said 7 last time, and she goes, oh no, it's been longer than that. She was our second referral with the company, and she's still with us today.
It's wild. And she's been probably self-directing her entire adult life.
And we're hoping that she'll be on. She's excited. She wants to tell her story because she has a story like
so
none.
many stories.
But so the barriers for her, now you're taking out, she's been with us for over 7 years. The state's DHS is getting ready to pull support broker services, right? Because of whenever this new scope goes into place. But the problem is, it's not that she doesn't have the ability to do it.
She's completely intelligent.
So intelligent. The systems are failing her.
No, the fiscal agent's portal is not blind friendly. Mm-hmm. And this participant in particular had been essentially robbed when I first started working with her, because the system she was able to use, or not able to use, allowed the staff to punch in, punch out, and not work. And it's because she's blind and she can't see the app in front of her, and it doesn't speak to her like all of her devices speak to her. So things that we do for that person in particular that keep her independent, thriving in her own home. We help her with her renewals, of course. Mm-hmm. We help her approve time cards. We help her with her recruiting. We help her write her bills monthly. Yep. And that's really not a lot, but that's all disappearing. Yep. Except maybe they'll let us help her keep her housing going.
Yep. The question when we had this conversation last week, because we know it's coming, right? I've been back and forth with DHS, just how are we going to navigate this? How are we setting participants up for success when this change does take effect? And since we know it, I feel an obligation to at least share that with the members or the participants that we're working with. Like, all right, this is the change that's coming. And the first thought was, I'm going to have to go to assisted living. Mm-hmm. That's sad.
It's so sad.
That's sad. That's the first thought that has to come to mind, instead of what systems are there to help her succeed, so that way she doesn't have to go assisted living. She can still self-direct her cares. Because we've already had it where people were punching in, out, handing her a phone to scribble. She had no clue. And that's why they started asking us to help her. Because if you tell her, all right, so-and-so was here from this time to this time, she goes, no, they weren't.
Yeah, she's got a memory like none other.
I know. I hope I'm that sharp.
Oh my word.
She's amazing. Like,
She really is.
Going on upper 70s and her memory is like, whew.
Infallible.
Yeah. So it's situations like these that, yes, Iris is amazing. Family care is amazing. All these different programs that out there are amazing with the supports in place.
And that's what's being ripped away, which, if you think about it, excludes a ton of people, thousands of people from choosing Iris as their provider because it's a fully self-directed program and they would have to do it without a safety net.
Yeah.
And so the people that we support on Iris, I mean, again, have just a broad range of abilities, but it's anything from autism, deaf, blind, physically disabled. So, and all of those come with just like unique barriers that we fill the gaps. And that's what we're doing. We're just filling gaps.
Yeah.
They can do it.
Yeah.
We're just filling gaps. Sometimes that's just reading for them. Sometimes it's picking something up because we can drive. Like, it's just filling in these stupid little gaps that don't need to exist. But that's what's being ripped away. And kind of like, no one should be like, oh my gosh, that's so surprising. They haven't been notified.
Right.
They haven't been notified.
That's
and this
what we have found.
This change loosely goes into effect from our limited understanding 3/1. Because we're losing our OS 228.
Yep.
So 3/1, but there's a lot of confusion there. So there's just, but yes, the participants have not been updated, which is very frustrating because they're about to lose their safety net. They're gonna be self-directing without a safety net.
Well, and from my understanding, the Iris consultants are just learning about this as well.
They learned about it. So the first one that we knew was probably about a month ago, but the ones that we've reached out to since don't.
Yeah. And
they've been given limited verbiage on what's about to happen, and it's about as clear as mud.
Right. Even my communication back and forth that I've shared with you, like these, what does this mean? Right. Yeah. I need your interpretation on this because it's so vague. What does this mean? I ask us questions specifically about this, and I get like a generic thing back, and I'm like, but is that a yes? Is that a maybe? Maybe?
I mean, what I'm reading is a maybe, but I think what I'm also understanding is that it's open to interpretation.
Yeah. And I think
by the Iris consultant, which is kind of with this, like the Medicaid, just the government just having so much gray. So much gray for interpretation. Even like we always talk about, like you can walk into one paraplegic's home and they have 12 hours of care a week. And then you walk into the exact same diagnosis in another home, 24-hour staff.
Right.
What? Math does not math in Medicaid.
Right. What is the difference here?
Yeah.
Right. What is the difference in?
We just wander in this like field of grayness and just try not to do things wrong.
Right.
Because we are a third party working with third parties. So we are trying to work very collaborative with the fiscal agents because they are so important. We are trying to work very collaboratively with our care managers because they are referral sources and very important.
Yeah.
But we are a third party kind of wandering in the same pit of gray that they are.
A lot of collaboration. And that's always been our goal, right? We have...
Well, that's how we grew this year.
Networking and collaboration. Yeah, that's all we want. We want to truly understand the processes that lead up to our services.
Yep.
And how can we best support that process?
Yep. Yeah, I think the conversations that we've had with the fiscals, although I love all the fiscal people that we work with, they're just lovely people. But I don't know that I still truly understand why it takes so long. I don't get it. I feel like I need to go to their desk and sit with them.
Yeah. And
truly understand why it takes so long. So that I can maybe see I could have removed that barrier. That's what you've been waiting. That's what held this whole process up. I could have done that. I'm boots on the ground over here. I live 2.1 miles away from them. I can go figure that out.
Yeah.
But I don't know that I don't know that I've ever walked away being like, we can fix that because I get it. I don't know that we've ever been there.
That's always our goal. That's the top of our list, I feel like, to work hand in hand with the fiscals and really have them utilize us as a resource.
Yeah. Let us be the gopher.
We haven't been there yet.
No, we haven't. We have so much teamwork with one of the fiscal that we work the most with. There's just so much teamwork there. But I still don't understand their process. Still truly do not understand that once all paperwork has been submitted, why it is taking 7 to 10 business days to get a turnaround. And also, why for one member it takes 3 days, for another member it takes 15.
Yeah.
Like it just doesn't, it doesn't make sense to me. And I really need to understand that, because for retention purposes, we need to get these packets done faster. No caregiver can go 30 days without a paycheck.
No, because by the time they get onboarded, and we've seen as long as 3 weeks, we have one that there's been a lot of complications. It's just not truly fair. But I would say like the longest one, I mean, we're in the 20s, like day 20 business days, like 20-ish business days to get the okay to work on some of these new hire packets. And that's like when things have gone well. So, and then once they get that done, then you still have the pay period. So you're talking, it could be a month and a half sometimes before you get paid.
Yeah. And then the other scary factor that's in there is that all the fiscals utilize different software and different processes, and they run the risk of not getting paid because there's just a lack of education. Yeah. So like that's where we kind of fill in those gaps too, if we're allowed to be. But yeah, they could go even longer if something's skipped. Like I have a member right now, one of his caregivers hasn't been paid since December. Actually, so he started in December, has never gotten paid. Total misunderstanding of like the process and like how you do everything. And so he just didn't get paid. He was very nice about it. We got it all worked out for him.
Still hanging on.
Yep. He's just, I mean, it's in Sturgeon Bay. Yeah. Sturgeon Bay people are just different. They're just nice.
They're neighbors helping neighbors, to be honest with you.
It is. That community's just nice.
Communities. That's what I love. My favorite communities are the small ones where neighbors do still help neighbors.
Yep. That was my very first time recruiting in a truly small community was when where did he live? It was in Door County, but I don't remember where. I think it wasn't Egg Harbor. I think it was just Door County. I think it was in Sturgeon Bay. Yeah. But the flock of individuals, when they realized that there was a community member in need, I'm like, hold the phone here. I don't get this response in Appleton. Yeah. And I got him 2 qualified caregivers. I'm like, that is just insane. And they both started.
That's like the hot word, like the community. I use that word a lot. Keyword is like community. Helping.
Yeah. And I think that, we can say a lot of negative things that came from the COVID days, but I think one thing that we can take away that's definitely a positive is that I do see a lot more community now. Yeah. I do see community helping community, and there's a lot more investment into people within your neighborhood, like your specific, like I can walk to your home neighborhood.
And that's nice because that's what we need. There's still a lot of bridge that needs to be.
Oh, so much.
We need to get, bridge the gap, but we're making good headway towards that. So, and I mean, there's a lot of positive in self-direction. I think people as caregivers can understand it can be for just supplemental income. Couple hours here, couple hours there, all the way up to full time. We have people that are 24/7 and that need care, but what is the benefit? You get work-life balance. Yep. You're not getting forced shifts like in a facility. No, right.
They are required to have their own backup plan in self-direction. Yeah. So you are not the backup plan. Yeah. Like if you stay an extra 8 hours because you have a kind heart and availability, more power to you, but you are not forced to.
Yep. And that's where a lot of people have that, they have to find that work-life balance, right? And they can build it from there. Yep. You can work with multiple individuals. You have to interview with multiple individuals. They have the say in whether or not they want to hire you. So there's a little more work that goes into it, but there's a possibility.
There's absolutely a possibility. And we had networked with, I think, 2 people who had built their own little clientele doing self-direction. She didn't know she was actually working for self-directed individuals. So that's not a word she knew. And she had an entire full-time schedule of self-directed humans. Did not know that word. She's like, that's what that is? I'm like, she's like, GT? I'm already working through GT. I'm like, then you're self-directed. You're a self-directed caregiver.
She thought GT was an agency.
Yep. So they don't understand.
We get misunderstood like that all the time. Yeah. We're an agency. We're a supportive.
Yeah. I say on like every phone screen, we are not agency. Yep. We are not agency. Because I want that to be like so front and center. Yep. We are not agency. We are a third party working for this member to find us in-home care staff. And then once the hire is made, you become their staff. You call him. If you have a day off or a flat tire, I am not your call.
Don't call us to call in.
No, which happens
all the time. Yep. Like, did you call so-and-so? Did you let so-and-so know?
Or when they resign,
Yes.
Did you let the member know? Well, no, can you? Absolutely
No.
not.
They're your employer. We're not the cop out.
No,
absolutely not. It's funny how many times I get like child support orders or unemployment letters or anything because they always list Community Horizons as the employer. And I have to send back on a sticky note, not the employer. Not it.
I think we've gotten a lot of doozies, but I think one of my most favorite was our member who was blind. Their caregiver wanted to resign. And I said, you need to call her. And they said, can I text her? And I'm like, she is blind.
She's blind, right. What?
And you know that because you've been working there for 3 months. She is blind.
Mm-hmm.
So please don't text her.
Yeah. We've run in some really interesting scenarios in this world.
Yep. Well, because it's humans.
Yeah.
And humans are going to human at the end of the day. They are all humans that are going to do human things.
Sometimes you just have to scratch your head and be like,
that just
didn't
happened.
see that one coming. Like,
Yeah.
what just happened here?
I do that. I'm like, wow, you can't make that one up.
No.
But I forget to write them down.
You should.
I know, because I could have a book by now.
We need to start writing them down and just reading our stories at the end of every podcast as to you'll never believe.
Yeah, like what was said to me this week. Whoa. And some of it is like I don't know what it is about me as a person, but like I could be standing at Walmart in the checkout line and like people unload on me.
Always.
Yep. Like that is just something that has always happened to me. So like caregivers will do it too. I will know their entire life story. I'm like, wow, I did not need to know that.
You have that personality. Like people just divulge into.
I just absorb it. And I don't know if it's because I'm like my lack of facial expression or something like that. I was like they don't feel judged. They just keep talking. And then I'm like, and I'm not judging you in my head, but at the same time, I'm like,
the stories you tell me, I'm like, wow. Like, what do you do? You should put out like, and it's almost like
sometimes like I'm on like I'm a fly on the wall because some people say things in front of me that like, I got to report that.
Right.
It's like, I didn't get away. Like I signed the same Medicaid agreement that you signed. Like, why did you say that? Yeah. I'm not going to report
it. They're just trying to determine your trustability.
Is like, so like, I'm just like, and I'm not quiet. Like I'm not a quiet person. So like, it's not like I just sit there and like don't say anything. So I'm like the fact that like things are. But I also think people say things out loud because they don't know that they're not supposed to. So there's goes back to education. Yeah, they just don't know.
Yeah, you need like a sign they'll hold up like, don't say that.
Yeah,
like
stop.
Please don't. Stop.
Stop talking.
Please don't. Take a step back.
How should we wrap it up? Maybe wins and losses of the week?
Wins and losses of the week.
Yeah, what was your win? Oh, we don't want to start on the win. We're going to start on a loss, end on the win. A loss this week. I don't know that I really had one.
Honestly, my week has been a little wonky just because I've been in the office more this week than I've ever been since we've opened the business, which is really weird. But I'm also working through like a whole year of receipts and
the fun
statements and all that stuff. So I'm going to call that my loss because
it's not fun.
It's just not fun.
No. It's
just boring, to be honest with you. I thrive out in the community. I thrive in front of people and doing that. I have to call this my win because it got me out of the office today.
That's awesome.
Yep. And I get to go see our members. So
yeah, that's awesome. I think my not awesome part of this week was Indeed's up to Indeed stuff. They're just Indeeding on us. I don't know.
I think that's like at least 10 episodes.
Yeah. So
sorry, but not sorry.
Yeah. Sorry, not sorry. Stop Indeeding on us if you don't want us to call you out.
Right. They're a pain in our butt right now. They have been for years.
Yep.
For years, but we're finding our way around.
Yeah. I mean, we always knew that Indeed wasn't going to be a forever for us. So like we're pivoting. It's what we're professionals that we're pivoting. So yeah. So that's not. I mean, it's not. It is what it is. It's no different. It's no other situation that we haven't tackled in the past. We just kind of have to overcome it. I think the win of this week is having our new housing counselor pretty well trained in working within the caseload with the safety net that I'm providing, and she's doing fantastic.
Yep.
And I love that you've been in the office seeking out our support brokers because that really needs to be filled.
So anyone that shares our passion, and I think next week maybe we'll dive into exactly what support brokers are, who we are, what we do, how we help. But we are looking for a full-time in Appleton, a full-time in La Crosse, and a full-time in Central. Like, our growth has been amazing, and we have the best team.
We really do. We have good staff. And
anyone who's interested in the self-directed world, we're 40. I want to say our map says 47, but we have a hold on a couple. So we'll say around 40, anywhere from La Crosse all the way over to Green Bay. We have the entire central part of the state all the way up to pretty much Vilas County. So we recently added all of our jobs on our website. I guess that could be my win as well. So they're easy to find. So anyone who's interested can go to our website at communityhorizonsllc.com, go to job opportunities, and they can see exactly what's all out there and apply directly online now. So
awesome.
Trying to get away from
helpful. Pivoting.
Pivot. That's our favorite word.
It is. It really is.
We're good at dancing.
Well, and again, working within the gray waters of Medicaid, government operations, we have to pivot because they're always moving the goalpost. Yep. Here we go.
On to another topic next week. Fired up, and
sure we can figure something out. Get fired up about.
Yeah.
It won't be hard.
We'll explain a little bit more about who we are, what we do next week, and
cool. Works for me.
All right.